know, Dr. Jansira, your work is all about taking preventative action. Can you talk a little bit, I know you mentioned it earlier, but about what you do and why it's important?
Yeah, so a lot of my research revolves around preventing pregnancy complications or even understanding how they develop.
Okay.
Most of that is around preeclampsia, which is high blood pressure in the second half of pregnancy. But it's more severe than that because the organs begin to be damaged, like the kidneys or the liver or the brain even. So, and we know that any woman that develops a pregnancy complication, in the years after pregnancy, she's much more likely to go on and develop other cardiovascular disease, and not like way in the distance, like in 2 to 5 years after that pregnancy.
Yes.
And so a lot of that's been just missed in our general care. We don't really talk about preconception care as much. We assume, oh, you're in your 20s or your 30s, like you're healthy, nothing's wrong. We go through pregnancy, you know, women have a lot of care then, and then they're kicked out, they go take care of their baby, to similar to Dr. Gillespie's work to bridge that. Yeah. And we just still assume like, oh, everyone's just healthy in their 30s, but that's not necessarily the case. So what I look at is how can we improve our health? A lot of that through behavior modification, things about like diet and physical activity and stress, but they all really come together. It's not just one of like eat this or move this much.
Okay.
It's bringing in all these pieces together. And I think the stress management piece really builds into that a lot. Mm-hmm. Everyone knows they're supposed to eat healthy and they're supposed to exercise, but that can just be another stress in people's day. So kind of how to bring these pieces together, make the changes that work for your entire family too. And what I hope too, by looking at the kind of the preconception, so before a woman becomes pregnant and her partner as well, that we can make these changes for the whole family, that they'll be totally healthy by they reach you in midlife. We'll be all good to go. We'll get some of these things done. But we know that if we are entering pregnancy kind of at a more optimal health, we are less likely to develop pregnancy complications. We're less likely to develop those cardiovascular disease risk factors afterwards. So that's kind of how I bring all those pieces together.
Well, based upon the work that you're doing, what do you say to a family or a mother who may have a diagnosis or an unfavorable health condition during their pregnancy? How do you console them and make sure that they're going to be confident enough to go through with the delivery, and making sure that they're calm enough and their stress is reduced so that way that there aren't further complications?
So I think a big piece of it is just providing people with information about what to expect in the pregnancy, information about what to expect for pregnancy complications if they are at higher risk, explaining to that patient, like you might be at higher risk for developing this complication, like preeclampsia, for example, and especially for providers to explain to the patient like what we're going to do about it. So how we're going to monitor you, what you can expect. I think one of the scariest things about preeclampsia is it can often mean a really early delivery. Like baby might have to be delivered at like 28 weeks, which is like 2/3 of the way through pregnancy, and that can be so scary. And a lot of that comes from it's out of nowhere. But if we can kind of prepare families to like know that that might be a possibility, they can at least be prepared and at least kind of have the expectation for it a little bit, as opposed to the shock of, okay, we need to have a baby today because mom's health is starting to deteriorate, so we need to get the baby out. So I think it's a lot of information. Be upfront. If you do have health conditions, speak with your provider before you start thinking about getting pregnant to see if there's anything that we need to adjust before you conceive, and just kind of keep in contact. Keep asking questions of your provider. Most pregnancies still end completely normally. They're not all complicated. Most of them are fine, but just keep asking questions. I think, and providers keep providing as much detail as possible so that patients and families can plan for what's going to happen, or at least have information, because I think information is power for feeling more confident in what's going to happen as the outcome of your pregnancy.
Absolutely. Well, this is such an important topic. I would ask you, why is this important to you? How did you get into doing this? So
I have been fascinated with pregnancy since I was a baby. So my mom actually, when she was pregnant with my brother was delivered, he's about 4.5 years older than me. My brother almost died. Oh, wow. So she was way overdue. For whatever reason, she went into labor, but she wasn't progressing, and they kept sending her home instead of admitting her. And when they finally went to go put a monitor, there was like a little pouch of fluid left around my brother's face. So he was born by emergency C-section about 90 seconds later, but they had double dosed her epidural, and she couldn't move afterwards initially. So she was just so scared. And then when she was pregnant with me, she tells the story, I was just scared every single day, like every time we went to the provider's office. And I just thought, we have to do something better than this. Like, pregnancy is the most normal biologic function to exist in the entire mammal world. It's something that's been happening for millennia. If it hadn't happened, we wouldn't be here. It's not supposed to be something shrouded in secrecy and fear. It should be an exciting time for families, and they should feel empowered through this experience, not traumatized. So that's really what a lot of this started. I was trying to find more information. How do we know, what's going to go wrong in pregnancy? How can we prevent it? If we can't prevent it, what can we do to prepare families so that they have the best outcomes that are possible? So even if it's a scary delivery and baby has to come at 28 weeks by emergency C-section, still providing as much support around those other pieces so that families can still have, a good experience forming their family and not, these experiences filled with so much trauma.
Thank you so much for sharing. That's very heartwarming, and it takes a lot to be able to be vulnerable in any space. So thank you so much for sharing that. I personally appreciate everything that you're doing, and I know that there are many people out there who will take interest in what you're doing, especially first-time mothers or even experienced mothers who are just going through, they may be in a rural place where they may not have access to top-tier health care that can utilize everything that you've just mentioned in terms of equipping themselves, asking questions, and being able to take as much preventative action as possible to prepare. So thank you so much for everything that you're doing.
Well, I enjoy the work, and I think it brings together a lot of important pieces to keep families healthy and to kind of keep the next generation healthy as well as a result.
Yes, the next generation. And then I think that's a really good point to each of you. Everything that you all are doing is actually aiding in setting up the next generation for success. So personally, thank you so much for your work. Thank you, thank you, thank you. It matters, and I just would hope that you all would continue with your passion and continue making the differences that you are making. So thank you. Thank you. Thank you. I did mention earlier that I had a burning question for Dr. Williams, and so I think that this is now the most appropriate time to ask. And maybe I'll ask you more questions later. But for now, considering the wealth of experience here at the table, as well as the wealth of experience with everyone within your tutelage that you work with, how do you see the Martha S. Pitzer Center in the future?
Well, the future is bright.
Okay.
The future is bright. We are hiring faculty.
Okay.
And everyone can't say that, so we feel very good that we're in that position. We're also in the process of talking to the county as well as people at the state and other agencies to see how we might do some things to address maternal and infant mortality. So we're just looking at some ways to maybe be to address some structural issues as well as be innovative. So those conversations are we've started those, and so I think stay tuned.
Okay.
We hope. And the other thing is that we're doing is we're surveying some of our rural hospitals to find out how we can help build capacity within their systems. So that's something else that we're looking at. But the future is bright here at the Martha S. Pitzer Center for Women, Children, and Youth. And we're excited that we've been able to contribute to the college being number 10 as far as NIH funding. So we're very excited about how things are going.
Well, listening to your passion and listening to everyone's response, I would agree that the future is very bright for the Martha S. Pitzer Center for Women, Children, and Youth. And again, I'd like to thank each of you for your time. I enjoyed hearing your responses, learning more about you, and maybe we should do this every day and get together and talk.
We can get together and talk. Yes, we can talk. And then, is that a stressor or what?
I was going to say see you tomorrow.